One might say that the seeds for the Hawaii Health Information Exchange were planted with the Holomua project in 2004. This federally funded demonstration project utilized health information technology to improve care in Hawaii. Hawaii's HIE was born as a nonprofit in 2006. Governor Lingo declared it as the state's qualified state designated entity for HIE in 2009. This, along with receiving its 501(c) status in 2010, allowed HHIE to receive two large federal grants from the Office of the National Coordinator, ONC, totaling more than $10 million from 2011 to 2014. That was the major jumpstart. Hawaii's HIE mission is to positively transform healthcare in the state of Hawaii through the efficient exchange of critical healthcare information between appropriate parties, including consumers and providers, with total confidence in the security of the systems and the validity of the information. The first part of the vision statement states that we envision a Hawaii in which all residents, regardless of where they may receive their care, can obtain quality care that is based on their own up-to-date health records. So let's say Bill is a 60-year-old who unfortunately is involved in an automobile accident. The ambulance sends him to a hospital. Bill's never been to this hospital, and his cardiologist is not affiliated with the hospital. It's 2010. The ED clinician needs information on Bill. Does he have any chronic condition? What meds is he currently taking? Are those EKG changes new? Are those elevated liver enzymes? Are they chronic or new? In 2010, there is no immediate access to any clinical information electronically outside the system. A scurry of phone calls might be made, faxes sent, but more realistically, the ED clinician needs to start essentially with a blank page. So what has happened in the first 5 years? The first 5 years of the HHIE strategy roadmap has focused on creating a governance structure and an architectural framework for data sharing. The governance of Hawaii's HIE consists of roughly 25 stakeholders. The majority of these stakeholders, 21, make up the board of directors. Key policies and procedures have been carefully vetted and put into place. Data sharing has gone from nothing to now Hawaii's HIE has data sources coming from throughout the state from over 40 sources. The first core set of services provided through HHIE is the HealthyNet suite of services. These include the Community Health Record, referrals management, medication history, direct secure messaging, immunization registry reporting, reportable labs to DOH, past provider provisioning tool, and security awareness education. 859 clinicians and 1,222 staff have been trained in using HealthyNet, and onboarding continues at a fierce rate over the next 6 months. To date, the volume impact includes over 1 million unique patients. That's about 66% of the state's population. Over 1.4 million direct secure messages are sent each month. And to date, that's over 21 million messages being sent through the system. The use and volume of network referrals also continues to grow, with over 120 being sent just last week. The second core set of services is a set of consulting services, and these include meaningful use reporting, transitions of care connections, PQRS reporting, patient-centered medical home reporting, chronic care management, audit support, and security awareness training. HHIE has impacted over 525 providers, 112 practices, and Hawaii's major hospitals through their expertise in meaningful use. Is there a future for meaningful use? However, quote-unquote meaningful use matures in the future of value-based care, it is sure that health informatics will continue to be embedded in the design of healthcare delivery. So what does this mean for Bill? In January 2016, Bill may now arrive in an ED that is connected with HealthyNet, where the ED physician can access important information and data about Bill, no longer working from a blank page and potentially avoiding duplicate testing and reducing the time that takes to gather information by 42%. May arrive and the data may be there. We have achieved a great deal of data interfaces, but it's still incomplete. And where do we need to go from here? Our roadmap would tell us that our next steps are in data capture and in allowing accessibility for quality improvement, outcomes management, and population health. What we do now is intake records through interfaces. And what we have yet to do is parse records to obtain discrete data that may be requested by particular hospitals, health plans, and physician organizations, or even the state. Translate and transform the various discrete data to a standardized format. filter, and route and deliver this standardized data to those who are requesting it for their analytics, public registries, and population management. Hawaii's Health HIE major vendor is Medicity. Their network of solutions are broad, looking forward to population health. We have 3 of the 7 solutions licensed: Connect, Exchange, and Organize. Additional solutions are available if our strategy dictates it. And do we have the funds? External consultants in 2012 projected funding source forecasts, and they have not completely matched up with actual funding. The original federal funding sources essentially have sunset in 2014. Some federal funding is available through a 10% matching state grant, which is awaiting state implementation. Original forecasts for state funding did not come in for fiscal year 2014, but did come in lesser amounts for fiscal year 2015 and fiscal year 2016. Private stakeholder subscriptions and contracted consulting fees have taken up part, but not all of the slack for the budget shortfall. HHIE's vision is a Hawaii in which all residents, regardless of where they may receive their care, can obtain quality care that is based on their own up-to-date health records. People like Bill. As a community, how might we narrow the distance to our vision? How do we create health in Hawaii in a physically responsible and sustainable manner into the future? How do we continually create an HHIE that is indispensable? A future where health information and what we can leverage from the data, information, and action is embedded smartly into the fabric of the delivery of healthcare.